Hello and welcome to a new episode of 2 Minute Physiatry. I am Dr. Kaustubh Chakraborty and today I shall be talking about myofascial neck pain. This is a common cause of neck pain across all age groups but more so in the younger age group. And the common misconception is in younger people this neck pain is due to cervical spondylosis. However, what usually happens is that if a student is spending long hours flexing his or her neck forward and studying, or a teacher is correcting answer scripts, or somebody is spending long hours on his or her laptop, keeping the neck in a particular fixed position, there is strain in the muscles. If allowed to continue for days, this chronic repetitive strain disorder causes a microscopic damage in certain areas of architectural weakness in the muscles, leading to the formation of a nodule or a tight band and causing this pain. This pain may sometimes radiate downwards along the upper limb or upwards along the occiput, this back of the head or mid-back region. We need to rule out certain causes such as cervical spondylosis, but the diagnosis is evident on deep palpation of these muscles, which gives rise to this pain, and the patient will report similar symptoms as the pain when you press upon the muscles with a force of around 4 pounds per square inch. The treatment is not very difficult. What we need to focus on is to remove the offending factor. Lifestyle modifications such as doing the work at a proper desk so that the neck is at a particular angle for not more than 20 minutes at a time. We will encourage the patient to take 30 seconds breaks for every 20 minutes and also ensure proper illumination. When using the laptop, use the magnification function so that there is no craning of neck. This particular movement is very detrimental to the development of myofascial pain as it causes overstretching of the muscles. If the student or the teacher can make a slanting rest so that the book or the copy is at an angle of 30 to 45 degrees, he or she needs only to move his or her eyes for writing or for correction, and that will prevent a prolonged flexion of the neck. During times of acute pain, we give some analgesics, muscle relaxants, and ask the patient not to lift heavy objects for a certain period of time, maybe 3 weeks or 6 weeks, depending upon the case. We also add certain drugs which, not being painkiller themselves, help to modulate the pain, helps the patient to tolerate the pain better. And so these category of drugs also ensure a good night's sleep so that the body gets time to heal itself. If the patient has uncontrolled diabetes or hypothyroidism, or maybe in certain cases a low level of vitamin D, we need to correct these factors so that the patient heals faster. Once the pain subsides, we need to ask the patient to start some exercises to stretch these muscles, and after some time continue our program of stretching as well as strengthening of these muscles along with the lifestyle changes so that there is no recurrence. Some physical modalities such as laser, TENS, or maybe ultrasound can be used to tackle this pain, and in some cases we need to inject those offending trigger points either by a dry needling to break the points, or we add some local anesthetic to it or some local anesthetic or steroid. And certain studies have shown that botulinum toxin type A has also some beneficial action, at least as good as these steroids. So this is in a nutshell the treatment of a common condition for neck pain in the young population, and I want to assure yourself that more often than not, it's not a case of cervical spondylosis, and taking simple measures will treat it. If you like this channel, please subscribe, share it with your friends and hit the like button, and I shall be back with a fresh episode of a 2-minute physiatry. Bye.